Hello, and welcome to the Dance Physio Podcast, a podcast designed to explore ideas and foster discussion around dancer health and wellness. We're here to challenge the status quo, bridge the gap between dance science and the studio, and help change the landscape of the dance industry for the better. I'm your host, Erika Mayall, a dancer turned physiotherapist who is deeply passionate about leaving the dance world better than I found it. I'm so glad you're here. Let's get started. Hello, everyone, and welcome back to another episode of the Dance Physio Podcast. I am your host, Erika Mayall. Before we dive into today's podcast episode, I just have a little request from all of you listeners. I am planning to do a Q&A style episode for an upcoming podcast episode where I would love to answer as many questions as possible from the community, from the audience, from all of you guys out there who are listening. So if you have anything you have ever wanted to ask, and it could be about a specific injury we see in dancers, certain training practices we see, anything to do with dance science or sport science, dance medicine, anything like that, please send them my way. You can send me an email. My email's in the show notes, or you can also send me a DM over social media, and I will start compiling a list of those questions. And in an upcoming episode, I'm going to do my best to answer as many questions as I can from the audience. If you want your question to be anonymous, that is totally fine. I do not have to read people's names out or anything like that in the episode, but I just thought it would be a fun way to do an upcoming podcast episode. So send me all the burning questions you have about anything to do with dancer health and wellness, dance medicine, dance science, any of that type of stuff. All right, now on to today's podcast episode. Today, we are going to dive into talking about all things sleep. And I have talked a little bit about sleep on the podcast before, but in the greater context of like rest and recovery. So we've touched on it a teeny bit in some other episodes, and I will link those if you're interested more in a broader view of rest and recovery. I will link those episodes in the show notes. But today I want to look just specifically at sleep. And this kind of became a topic of choice for a couple of reasons. First of all, I was doing a talk at an event. It's called Spring Seminar. It's put on by the Vancouver Ballet Society here in Vancouver, and it's like a spring break ballet intensive for dancers to participate in. And they bring in speakers to do lunchtime talks on various different education topics. And so I was there talking about kind of dancer health and wellness. And one of the questions, or one of the subjects or topics that always comes up is sleep and this idea around sleep. And it's one of those things that dancers know is important, but often still struggle with optimizing or getting an adequate amount of, and things like that. So I wanted to dive into that a little bit more today. And then I also happened to be reading the latest issue of the Journal of Dance Medicine and Science, and there was an article that was looking specifically at sleep, and they were actually looking at it in relation to a couple of different factors, but looking at it with relation to psychological inflexibility and looking at how sleep quality and sleep chronotype and stuff affected that. So there's just been a few things kind of floating around recently that made me think, okay, I think it's time. The universe is telling me it's time to do an episode specifically on sleep. So, like I said, I think a lot of dancers are aware of the importance of sleep, and even just in society in general, people are aware that sleep is important for optimal health and well-being. But knowing that that is the case and being able to actually optimize our sleep are two kind of different things. So today I want to talk a little bit about like where we're at in terms of the state of what the data or research tells us with regards to sleep and athletes. We're going to talk about some of the impacts of poor sleep and why it is we need to optimize sleep, but what the impacts are if we're not getting adequate amounts of sleep. And then we'll talk about strategies that we can use to try and facilitate dancers being able to achieve optimal amounts of sleep. So we know that dancers struggle with poor sleep. And that article that I was referring to that just came out in the most recent issue of Journal of Dance Medicine and Science, so this is like a 2025 published article, they found that 80% of the dancers in the study actually experienced poor sleep or had sleep issues. They were looking at dance students. So these weren't professional dancers. They were dancers in like kind of conservatory training type programs, but they were over the age of 18. So they weren't adolescent dancers. They were, I think, between, I'm going to say 18 and like 23-ish, but in that kind of age range in through there. Previous research has also supported the idea that dancers experience poor sleep quality, but the numbers have maybe been slightly lower. I know one other study, I think it was about 60% of dancers in that one, and these again were dance students, were experiencing poor sleep quality. So it is not uncommon for dancers to be experiencing poor quality of sleep. We know that in order to optimize recovery and have optimal health and well-being, we should be getting a minimum of 8 hours of what we deem, sort of quote unquote high quality sleep a night. And there's actually some research to support that number might actually even need to be higher, and especially in high-performing athletes or performance athletes. So some studies have sort of said that potentially that number should even be between 10 to 12 hours of sleep per night, which, if we think about all the dancers we know, or if you were a dancer yourself, that is probably unrealistic that many dancers that are sleeping between 10 to 12 hours per night. There's been some other research looking specifically at performance athletes. So these would be, dancers would fall into this category, but also potentially, figure skaters or things like that would fall into this category of performance athletes. And that study in particular sort of suggested that performance athletes should be getting between 9 and 10 hours of sleep. So the data is a little bit variable in terms of what the recommendations are, but certainly 8 is kind of the minimum, but research maybe suggests that it should be even higher than that at like 9, 10, even up to 12 hours of sleep per night. Obviously, there is some individual variation within this. You'll just meet people who are like, oh, I don't need to sleep as much, and other people who really, really need to sleep consistently a lot more hours. So there is some individual variation, but I think sleep requirements are higher than what we convince ourselves is adequate. And so it's not uncommon, I think, to meet people who are like, oh, I only need 6 hours of sleep a night, but they've really just convinced themselves that they can function on 6 hours of sleep per night because that's all they allow themselves to get. But if we actually look at increasing those sleep hours or optimizing that, they actually do function better. So I think we often underestimate what our personal sleep requirements are. There's been some studies that have looked at how much sleep dancers are actually getting. So they've looked at different dance populations. And in one study that looked at professional dancers, they were getting between 6.5 and 6.9 hours of sleep per night on average. So again, we're not meeting that 8 hours of sleep minimum, and then certainly not meeting anywhere between 9 and 12 hours of sleep. Another study looking at dance students, so again, younger dancers, they found dancers were getting 7.8 hours of sleep per night on average. So again, closer to that 8 hours that we would want as a minimum, but still not meeting that threshold. And arguably younger dancers may actually even need more sleep if they are still growing or going through other processes like that. So all of that is just to illustrate to you the issues that we see regarding sleep in the dance world. So a vast majority of dancers are getting poor quality sleep or are having issues with sleep. And then most dancers in studies that we're looking at, whether it be professional dancers or dance students, are not meeting the minimum require of number of hours of sleep per night. So how does that affect us as dancers? What are the impacts of having this poor sleep? Well, there's numerous impacts, but one of the first ones that we often think about is decreased reaction time. And if we're having to do intricate choreography or just movements or steps that are fast and require us to be able to react to other dancers in the studio, so we're not crashing into people, different choreographic patterns, things like that, we want to have optimal reaction times. We especially think about that, or I especially think about that when there's like acrobatic elements to dance or any sort of partnering work or interaction with props and sets and things like that that have a risk element to them. We don't want our dancers to be suffering from poor reaction time. Along with that comes decreased alertness. So these might be your dancers that just aren't as sharp and as quick as they normally would be. And so that can show up as not picking up corrections or not being able to, pay as much attention or pick up on like stage cues and things like that that will have an impact on their ability to perform. We also, along again, sort of similar theme, similar line, see decreased concentration levels with people who are not getting an adequate amount of sleep. And so again, this comes with our dancers who maybe are really struggling to pay attention in the classroom. They just seem like they're kind of spaced out or daydreaming or whatever. Maybe these are dancers, and especially if we're dealing with like students or younger dancers, maybe these are dancers who are not actually well rested enough. And so they're struggling with alertness and concentration within the classroom. We see impaired memory and learning as well. So our dancers who really struggle to pick up choreography or to learn an exercise in class or to retain corrections. If you've been giving them corrections, they just don't seem to be able to maintain or retain that information. It is possible that this could be related to them being not well recovered enough or not actually getting sufficient amounts of sleep for them to cognitively be able to function at an optimal level. We see decreases in neuroendocrine function in people who struggle with sleep or have poor sleep quality. And this is especially important to our dancers who potentially already have issues with neuroendocrine function from potentially underfueling or relative energy insufficiency or things like that. And so we want to make sure that we can do everything we can. And so obviously we need to look at fueling levels and all of that type of stuff. But sleep actually plays a major role in regulating our hormones and all of those types of processes happening within the body as well. We also see a decrease in immune system function. And so I think everybody instinctively knows this probably, that if you are going through a period of, busyness in your life, and so your sleep is suffering as a consequence, people are like, oh, I'm going to get sick. I know that I'll end up getting sick because I've run myself down. Like we even have expressions that are sort of related to that in terms of being run down and then getting sick as a result of it. So we know that our immune system cannot function as optimally if we are not sleeping adequately. And in the dance world, we don't want our immune system to be compromised in any way. We spend so much time in large group settings, and no dancer wants to have to miss out on performance opportunities or competitions or shows or things like that. And there's that mentality of the show must go on. And so we often see dancers pushing through those types of things as well, or coming to work while they are sick and then potentially spreading it to other company members or other colleagues and things like that. And so, we can't avoid all illnesses, but if we can optimize our immune system functioning, we can decrease some of those instances that we sometimes see where all of a sudden the plague, whichever plague it is at any given time, seems to just run through an entire company or a dance studio or those types of environments. We also have increased pain perception when we are not getting good quality sleep. And so what that means is people's perception of how much pain they are experiencing is heightened. And so just having a poor night's sleep can make people experience more pain in their body. Our body has less ability to cope with whatever it is that's going on. It's sort of that idea of the threat bucket where your body can cope with a certain amount of stuff, but as soon as something extra gets thrown into that, it kind of tips it over the edge. And so if we're already experiencing pain or an injury or something, and then we also are not getting adequate sleep on top of that, we are going to experience higher levels of pain associated with that. And then last but certainly not least, in fact, probably from my perspective, or what I'm often most interested in my practice, is we have increased risks of musculoskeletal injuries when we have chronic sleep issues. And there's actually been lots of research that's been done on this. And interestingly, so there was a systematic review that was done, I'm going to say 5-ish years ago. Don't quote me on the year of it. Maybe it's longer ago than that. And they were sort of trying to look at the effects of chronic lack of sleep versus an acute lack of sleep, because we have a lot of information that tells us about chronic lack of sleep. And so that is people who are consistently getting less than 8 hours of sleep per night. So they're consistently getting 6 hours or 7 hours of sleep a night. And we know in those cases that their risk for musculoskeletal injuries increases significantly. And in fact, it increases 1.7 times people who are getting 8 hours of sleep per or more per night. But with that research, we didn't have a lot of information, and turns out we still don't have a lot of information about an acute lack of sleep. And so that would be where you have 1 or 2 nights, let's say, where you're getting less amount of sleep. Does that also lead us to be more vulnerable to injury? And the research is less clear in that regard. But the research is very, very clear when we are chronically underslept. So that is like consistently getting less than 8 hours of sleep per night, that our risk for musculoskeletal injuries increases. And like I said, that increased rate is, in one particular study at least, was 1.7 times. So like I said, we know that that risk exists. What we don't know so much is whether that risk is the same with that acute lack of sleep. And I think that would be a super interesting area to study, because especially when we look at youth dancers or adolescent dancers who are participating in conventions or competitions or things like that, those events will often result in acute lack of sleep because they start early in the morning. There's often travel involved, and they often go very, very, very late at night. Some of them, it's just like obscene how late into the evening they go. They're having awards presentations at like 11 p.m. and there's still 8-year-olds in the audience, and then they're expected to be like up for class the next morning at 8 o'clock. It's a little bit crazy, but I think it's something we need to consider, that we don't actually know what the true effects are in those situations of that acute lack of sleep, whereas the chronic lack of sleep, we do have much better data to support that. So all of that to say that we really want to try and optimize sleep in dancers, and not just in dancers, in humans in general. All of these things hold true for other people who just want to perform throughout their life and really be able to like live life to the fullest. But in dancers, it can be challenging, and oftentimes can be really challenging because of scheduling and just the environment that dancers are in. And like I said, we have those instances in the more competition or convention dance world where we have these really jam-packed weeks or weekends, and that is going to influence a dancer's ability to sleep. But in the professional dance world, this is a massive, massive issue as well, because dancers are generally performing until relatively late in the evening. And so when we are in a show period, oftentimes shows probably don't end until certainly after 10 p.m. and maybe, a lot of times close to 11 p.m. even. And then the dancer's still having to pack up, head back from the theater, whether that's going home or whether that's going to a hotel. And then they often still have loads of adrenaline pumping through their body. There's that like after show high. And so it takes a while to come down, do your nighttime routine, get to bed. By the time you fall asleep, it can be quite late. And then traditionally in the dance world, we often still expect dancers to be at class in the morning. And I think this is something that the professional dance world could start to or should start to look at in terms of the structure of what a dancer's day looks like, especially when they're in a performance season. And I know that this is different in different companies, and it's different, say, in like a Broadway show versus a ballet company and things like that. I know that there are variations, but traditionally, and especially in the ballet world, it is quite customary to have our dancers performing at night, and then company class is still in the morning, and it's still relatively early in the morning, and then maybe they have rehearsals in the afternoon, and then they'll be on stage again that evening. And it's something I think we should consider when we think about how are we going to allow our dancers to get adequate amounts of sleep. Maybe we can start to look at shifting company class to later in the day. Maybe it doesn't need to be in the morning. Is there a reason it is in the morning other than tradition? I don't know of any other reason other than tradition, but just something to think about when we are looking at, okay, how is it that we're going to try and allow these dancers to optimize sleep? And it's still tricky because some dancers, you know, if you naturally are more of a morning person, so you're still going to wake up in the morning, but you're not getting to bed until late because of performing, like things like that impact dancers' ability to get good quality sleep. But the more things we can do to try and optimize scheduling for dancers, and especially when dancers are performing, the better we're going to be able to support those dancers in getting adequate sleep. So what are some things that we can do in terms of what we call sleep hygiene? So sleep hygiene is a terminology that's used, I think it comes from like occupational therapy. I'm sure that was the first time I sort of became familiar with it was when I was in physio school, and we did a lot of work with the occupational therapists who were training at the same time. And this idea of sleep hygiene. And essentially it is all the things we can do to make sure that we are setting ourselves up for success when it comes to getting the best quality sleep. So, number one, limiting screen time at least 60 minutes before bedtime. And so this is phones, this is tablets, this is computer screens or whatever. They emit a certain frequency of light that can disrupt our circadian rhythm, which is our body's natural rhythm in terms of when it wants to be awake and when it wants to be asleep. So limiting screen time before bed helps our body. It helps signal our body that it's like time to wind down, and it allows us to get into a better rhythm for sleeping. So minimum of 60 minutes. I know a lot of people use their devices, whether it be their phone or a tablet or something, as an alarm clock and have it in their room. And there are some, schools of thought that suggest that maybe that is impacting our quality of sleep as well. So if you are someone who struggles with quality of sleep, whether that be difficulty falling asleep or frequent night wakings or things like that, it might be something to consider that maybe you get like an old school standalone alarm clock and actually leave your device out of your bedroom at night and charge it in, the kitchen or some other room in your house. But certainly limiting your use of screens before bed is super important. So number two, as much as possible, we want to have consistent sleep and awake times. Now, again, in the dance world, this is super challenging because if you're somebody who naturally your sleep time feels like it should be 10 p.m., you're like, that's the time I feel the sleepiest, that's when I want to go to bed, that's when I'm ready for bed. That might be possible some of the time, but then if you are in a performance block, but you aren't even leaving the theater till after 11 p.m., that might become really, really difficult. So it is not always possible to have consistent sleep and wake times, but as much as possible, we want to try and keep it consistent. The other time that people run into, I don't want to say challenges, but where this can be disrupted is when people have a day off, it's so tempting to be like, I'm just going to like sleep in for the entire day. I'm going to sleep until noon or sleep until 2 p.m. But this can really disrupt, again, the like circadian rhythm and your body's natural ability to regulate sleep and awake times. So as much as possible, we do want to be consistent even on days off or weekends and things like that. However, if you are chronically or really underslept, sometimes we do need to catch up on sleep. But we need to look at making sure that that's not interrupting the future sleep cycle. So if you sleep until, say, 1 p.m. on a day off, but then that night it means you can't fall asleep because you go to bed at, I don't know, let's say 10 p.m., but you've only been awake for 9 hours. So your body's like, I'm not ready for sleep yet. Then it throws off the next few days in a row. That's not a productive use of trying to catch up on sleep. But if you feel like you're really underslept and really need to catch up on sleep, maybe you just sleep in by an extra hour or two. And so that allows you to catch up a little bit. Or there is some research showing that if athletes are getting less than 8 hours of sleep per night, one 30-minute nap during the day can help them to make up some of that sleep, as long as that nap occurs early enough in the day that it, again, does not disrupt their sleep time or bedtime routine at night. So something to consider is that we want to be as consistent as possible with sleep and wake times. Number 3 for sleep hygiene is practicing different types of relaxation techniques. So this can be a huge variety of different things, but it just helps our body wind down, helps our body signal that it's time for rest and sleep. So this could be different types of mindfulness. I know a lot of dancers who really like using progressive muscle relaxation techniques. So these are sort of body scan techniques where you purposely tense up certain muscles and then really let them relax and progressively move through the body in a systematic way. You can use meditation. A lot of people use reading. I know I personally read every night before I go to bed. So turn my screens off or my phone off. And the last thing I do when I'm in bed before I turn my light off is I read. And it can be, some nights it might only be 10 or 15 minutes. Some nights it might be an hour. But every single night I literally can't fall asleep if I don't read before I go to bed. And that's when I get the majority of my reading done. I don't read a ton during the day necessarily, but certainly every night before bed, that's my way of kind of winding down or practicing a relaxation technique. Again, we don't want that reading to be happening on a screen, ideally. There are e-readers that are designed to not emit the same type of blue light, but if you typically read off like a tablet or a phone or something, that can potentially be disrupting sleep cycles. So consider reading actual physical books or a specifically designed e-reader that isn't going to emit that same type of light. Next on the list, limiting caffeine, nicotine, and alcohol intake. So again, this is going to be more relevant for older dancers, professional dancers, than it is for young and adolescent dancers. But we want to limit our intake of stimulants, and especially later on in the day. I know there's often a culture in the dance world of people going for drinks after a show and things like that, but we want to consider that impact that alcohol may potentially be having on our sleep and our sleep quality. So some people are going to be affected more by this, some people less so, but just something to consider in terms of, the effect of caffeine, nicotine, and alcohol. And then finally, on our list for things for sleep hygiene is we want to try and make sure we are sleeping in a cool, quiet, and dark room or dark space. So we want to try and facilitate the environment as much as possible. In terms of the quote-unquote cool, the temperature that is often cited in like literature and in sleep hygiene material is about 18 degrees Celsius. And so, if you have one of those thermostats that you can regulate during the day, you often want to make sure you kind of turn it down at nighttime. People generally sleep better when it is slightly cooler in the room. Some people love sleeping with windows open for that reason. That type of stuff is totally up to you. Some people like white noise machines or that type of thing to also create the environment. But generally, cool, quiet, and dark is what we are looking for to facilitate sleep as best as possible. So that is a list of a few things we want to think about prioritizing when it comes to sleep hygiene. The study that I was referring to earlier in the Journal of Dance Medicine and Science, like I said, they were looking at psychological inflexibility and its ties to sleep disturbances and different sleep chronotypes. And one of the things that the article sort of brings up that I think is important to highlight is that there is a big correlation between psychological inflexibility and other mental health issues like anxiety and depression and things like that. And those things will have an impact on sleep, and they also will be negatively impacted by lack of sleep. So it's one of those things, it's a bit of like a double-edged sword, if you will, where we want to try and optimize sleep as much as we can because it actually will help with whether it is anxiety or depression or whatever it is. But when we are experiencing those mental health issues, we also will often experience a lack of good quality sleep. So anything we can do to optimize other areas to prioritize sleep and that sort of list of sleep hygiene things. So maybe it's really honing in or focusing on some of the mindfulness techniques or things like that can make a big difference because we know that we will see improvements or positive correlations with some of those issues that people have that prevent them from sleeping or that cause multiple night wakings and things like that. So I just wanted to highlight that a little bit because I know it's all fine and good to understand the importance of sleep, but if you struggle to get good quality sleep, even with the best of intentions, you're spending enough hours in bed, but you're struggling to fall asleep or you're struggling to stay asleep, it can be really, really frustrating. So I just wanted to draw attention to that because I think it's one thing to say yes, we need to prioritize this. It's so important for our health and our well-being, but it's another thing to actually be able to, get good quality sleep. So if it's something that you're struggling with and you've been doing all of the things, I would encourage you to talk to a healthcare provider about that because sometimes there are different treatment options. There are some types of cognitive behavioral therapy that often can target insomnia and sleep issues. There can be sleeping medications and sleep aids and things like that. So certainly talk to a healthcare practitioner if this is something that you're struggling with and you're doing all the right things from a sleep hygiene perspective. But I think in the dance world in general, a lot of our dancers are not getting adequate sleep, not because of underlying issues with sleep, but simply because of routines and culture and tradition and just the way our society functions nowadays with everybody being plastered to our phones. It's so easy to crawl into bed at night and start scrolling and all of a sudden, an hour and a half has passed and it's way past what your bedtime was supposed to be and now you're not going to get enough sleep and now you're having trouble falling asleep because you were just on your phone on TikTok forever. So all of those things we can work to actively improve on. All right, I'm going to wrap things up there. Hopefully that is all giving you guys some information about things you can maybe look to improve in your own sleep journey. And perhaps you are one of the lucky ones who's already getting between 8 and 12 hours of high quality sleep per night. But if not, I would consider really looking at what your current sleep routine is, what your current schedule and structure and all of that is, and seeing if there's somewhere you can tweak it. Because realistically, sleep is one of the most important things that we can do for our health and well-being. So if we can prioritize that, we are going to have happier, healthier dancers. All right. I hope that was helpful for you. If you have any questions, comments, concerns, please feel free to reach out, send me an email, send me a DM. I love hearing from all of you. Thank you so much for listening, and I hope you have a great rest of your day.